Opening ceremonies. Do the Pledge of Allegiance. Everybody stand with me. I pledge allegiance to the flag of the United States and to the republic which one nation under God, indivisible, with liberty and justice for all. Ms. Teresa, do we have a roll call, please?
Commissioner Matthew,
Here.
Commissioner Hoffmaster,
Here.
Commissioner House, Commissioner Leininger,
Here, getting a donut. Yes.
Commissioner Baker,
Here, not getting a donut.
Commissioner Lanius.
Here.
You.
Very good. We have an agenda before us. Can I get a motion on the agenda?
Make a motion to approve the agenda as presented.
Support. We have a motion and support. Any discussion? Seeing none. Open up for a vote. All in favor with an aye?
Aye.
All opposed the same. We have an agenda. Item letter D, approval of the minutes for January 25th.
Move to approve the minutes as presented for January 25th.
Second.
We have a motion and support. Any discussion? Seeing none, we'll open it up for a vote. All in favor with an aye?
Aye.
All opposed the same. Our minutes are approved. Number 2, public comment. So this is where we will open it up for any public comment that is out there. All right, seeing none, we'll close public comment for the time being. Move on to Director Burns's health officer report.
Okay,
You're up.
good morning.
Good morning.
So I wanted to start by recognizing James Young, who is a staff member here at the health department. We missed James in our recognitions of service time. And so we are recognizing him today, 15 years of service with the health agency. He is in the environmental health section, was recently promoted to environmental health supervisor. And we want to make sure that he gets properly recognized. So we will get this certificate to him, both Commissioner Hoffmaster and myself. So, all right. The infrastructure grant, the bids have been collected. The painting board is again on the agenda today. And then carpet bids were reviewed at the finance committee meeting, and the agency has made a recommendation for one of those bids. With regards to our staffing update, environmental health, we have a sanitarian position in Coldwater that's been filled, and that individual starts on February 26th. In personal health and disease prevention, I want to welcome Heidi. Heidi is a clinic supervisor currently here in Branch County, and she officially takes on the role of the director on Monday. So she's a little early getting here, but I wanted to give her the opportunity to experience the Board of Health meeting and be here. So we are really excited to have Heidi in that role. She comes with lots of experience. Has been our immunization queen, so to speak. And she's going to do great. So the position that Heidi is vacating has been posted, and she will be working to get that filled. In administrative services, the human resource support specialist position has been filled. That person also starts on February 26th. And then the emergency preparedness coordinator position, we have made that offer, and that person also begins on February 26th. So,
Wow.
Yeah, lots of new people starting on Monday.
How many of those were outside hires?
The EPC's outside, the HR is outside, the sanitarian is outside. So everybody except for Heidi.
So now you'll have one interior position.
We've got that position. Are there any others? We still have a part-time nurse job posted. Anything else?
This is the sanitary position that's being vacated.
Oh, yes, we did have an EH sanitarian over in our St. Joseph County office who's leaving us for Kalamazoo. I think Paul's going to talk a little bit more, so I won't steal your thunder. Kindergarten oral health. So Chris, Dewey, our health education and promotion supervisors are working to gather information on existing COA programs of their local health departments This was an effort that the legislature put in place a couple of years ago. There's some funding there. They offered it up on a those who wish to participate kind of basis. And some local health departments did choose to participate. So Chris has been working to gather information about those programs so that we can basically pull all the information together, look at the funding that's available to us currently, and make a decision on if we are going to be able to run the program locally. There is an intent that every kindergartner will have an oral health screen by this coming fall. So, okay. Agreement with Hillsdale Hospital, a little update. I did check in with JJ Hodshire at the hospital, and they are still full steam ahead on getting approval. They have hired a nurse practitioner, so that's good news. And identified the driver. I think I mentioned that previously. Their startup date is now first week of June, if approved by the accreditors. Community Health Needs Assessment by Beacon. I've been asked to participate in that process. Beacon Health Systems is our Three Rivers hospital. They own hospitals in Indiana as well as in Michigan. And they are required to conduct a CHNA every 3 years. I am looking forward to that process with them. Staff education and training, we are bringing MERS in to provide staff with educational sessions on retirement programs that we offer. And they will be coming in soon. Health education and promotion is also working hard on our annual staff training day. That's scheduled for April 26th. We will have a time management presentation that day. And I think maybe we've narrowed down another speaker since then. Yeah.
We're still working towards it.
Still working on it? Okay. So we're working on making that a good training day for our team. Public health concerns, wanted to talk again about the bill package on lead. It was reported favorably from the House Health Policy and awaits a vote by the full House. That may have changed since I've typed this. The bills would amend Part 54A, lead abatement of the Public Health Code, and revise the threshold considered an elevated blood level in children, and to change the requirements related to lead abatement and mitigation of certain buildings and activities. So we anticipate with the updates and changes here that we will see more kids that are lead burdened and require nurse case management. So we do have a second nurse that's been trained now, and we'll see how that goes. May have to train more nurses in that regard. Respiratory illnesses, we continue to encourage vaccination for the flu and for COVID. There is currently an increase in flu in the state of Michigan, and we are not done with respiratory season yet. Haitian Creole speakers, in response to that increasing number of families we're seeing coming in from that to serve our Clemens facility here. We're working on adding translated documents. Our Health Education Promotion Department have been working with our clinical staff to get that done, and we have some products that have been put out. So that's good news. This is a challenging language. We have a translation service. That is something that we pay for. But when we dial up that translation service, Haitian Creole is difficult.
You need somebody from Louisiana.
Well, there you go. Yeah. So it's just an unusual and difficult to translate language. So really proud of my team on what they've been putting together there. Our City of Three Rivers action level exceedance. So not new information here again. City of Three Rivers, they have an action level exceedance in their drinking water for lead. That action level exceedance is continuing with their most recent round of samples. So we continue with filters for families and encouraging filtration of the drinking water there, providing education and information. And then I talk a little bit about health concerns in teens regarding health of teens experiencing unexpected health issues. And I'm gonna wait until I'm done here, and then I'm gonna talk a little bit about Quincy. So the MALF Day at the Capitol is scheduled for April 10th this year. I do need to still call our local senators and representatives to schedule a time to meet with them that day. If anyone's interested in going, please let me know.
What's Mel?
MALF is the Michigan Association for Local Public Health. Thank you for asking. Yeah. So our Coldwater office, we continue to work with Branch County on upgrades to this office. They are intending to do upgrades to our restrooms. We have a counter in our clinic that they are intending to replace as well. That needs to be repaired. And they've also mentioned that they are going to be painting this building this year. So lots of plans from Branch County to make upgrades to this building. Schindler is still scheduled. They haven't been here yet to work on the elevator in Hillsdale. And of course, we have conversations today about upgrades to the Hillsdale building and Quincy. So let me just pull up my notes. Last week, Thursday, on the 15th, we had 2 parents of Quincy students come into our office and talk with our staff about their concerns regarding illnesses that their children were experiencing. We initiated an investigative process on that day, working with our regional epidemiologist, pulling together our team here at the health department. Since then, we've been in constant communication with Superintendent Creamer at Quincy Schools. We've had communications also with William Poole at the city of Quincy, who deals with their water supply program, and have been also working with MDHHS and Eagle staff members. We've had environmental health do a walkthrough of the school, and that was yesterday. Paul and Joe and did that walkthrough. There wasn't anything of huge concern found from that environmental walkthrough. So we are finalizing an initial health survey for parents. I think we actually have a survey that we're happy with this morning, and have just, I believe, received a list of students from Quincy that have these symptoms or some of these symptoms. And so we're going to start collecting information from that survey tool on those families. Our intention also is to put the survey into a secure format that can be filled out electronically with our state partners, putting that together, and then sharing that with all of families in Quincy. So that if they would like to complete the survey, whether their student had symptoms or not, we would be interested in collecting whatever information families wish to share with us. So that should be coming out soon. As far as the actual number of students affected, it's really much too early for us to have any number for you. And the initial survey tool will help us to determine that. And the investigation will take time. This is not something that we're going to very quickly be able to say, it's you fill in the blank, okay? There's been a lot of social media on this issue and a lot of concern. And if I were a parent with kids with these conditions, I would be very concerned as well. So it's all very understandable. And it would be very frightening to have a student with these type of neurological symptoms. So we certainly understand and empathize with those families. We are going to continue to work on an investigation that makes the most sense and is scientific, and try to come up with answers for families. But again, it is going to take time, and we will continue to work on it. Any questions for me today?
I do real. Yep, go ahead. Go ahead.
Sure.
Yeah, go
I
ahead.
will
No,
urge to the chair first.
it's all you. Go ahead.
Can you share what those health symptoms are in Quincy?
So the initial reports were seizures, tremors, tics, and like
Okay.
twitches.
Right.
Yeah.
So,
Yeah.
well, I want to
And let's
Clarify.
clarify the tic.
yeah, because
Well, and a tick bite may cause certain symptoms. So it's just much too early to be able to say anything is the cause here. But those are the initial symptoms that were relayed to us.
Did I mishear you? Did you say that we did get a list of
I think that was received late last night.
a list of
From the
children
school.
who have at least said that they've had these symptoms?
Well, this would be a list produced by the school. So the school is sharing information on what they know.
Okay.
How many was on it?
I don't have it in front of me, Rusty. I think it's less than 10.
Okay, that's solid.
Commissioner Matthews?
Thank you, Mr. Chairman. Health Officer, Ms. Burns, thank you for that report regarding the Quincy situation. You mentioned that it takes a while to get the report, research, and already our team visited in Quincy. I wonder, you will be able to reach the Michigan Department of Health and Human Services to expedite an emergency way rather than taking considerable time. You as a parent, I as a grandfather, we all concerned. So I urge Mr. Chairman, the health officer to contact our MDHHS. You have a good contact with them. I know of that. And also our local state senator and state representative, what involve them and what they can offer to our parents and our children and our community. Thank you. Thank you, Mr. Chair.
Thank you, yeah.
Did I hear you correctly? You were in contract with Michigan Department of Health and Human Services, correct? Okay,
Yep.
Yeah, we had a Teams meeting yesterday, and I think we probably had almost 15 MDHHS staff members from the environmental section. So they're working lockstep with us to, produce a good survey document. They're the ones that are going to help us put it in a format that allows families to fill out that survey in a way that information is protected. So you can use SurveyMonkey, for example, to gather data electronically, but that's not a HIPAA protected or survey product. But we will be able to do that using our resources in DHHS.
And I encourage once we get those surveys out to those affected, that those are quickly responded to, and then we're kind of at the mercy of getting that data back so that we can actually use it to formulate some kind of solution, some kind of plan.
Yeah, I'm really just kind of looking for commonalities.
Yeah.
And that's kind of the first step, is to take a look and go, what do these kids have that maybe is in common?
Yeah.
And then we just kind of go from there.
Yeah.
So
Good.
Yep.
Well, I appreciate what you're doing. Go ahead.
Yep, you were in contact with Jonesville School, who now have a couple cases also.
We have heard from Jonesville Schools. I talked to the superintendent there yesterday, Eric Weatherwax. I wouldn't say that at this time in Jonesville we're actively involved in the same type of investigation, but we need to understand more about the calls we've gotten from the Jonesville family. So we're going to do some more checking.
Are they
into
similar
that as well.
conditions?
That's what I've been told, but again, I don't have all of that information.
Okay. Keep us posted on that.
I will.
Very good. Any other questions for the health officer? Nope. Okay. Moving on to our medical director's report, Dr. Lubretto. Welcome.
My report is in the packet. So I guess a little different this month. My diversity in healthcare class, which is a lot, but very interesting that you can work in healthcare forever and ever and not really understand some of the diversity issues. Like I just had to do a little report on Black infant mortality and how it's 2 times that of white infants. Even in parents with equal socioeconomic status and equal education, and so very interesting. And lots of policies that need to be worked on to kind of rectify some of those things. sat in on the interviews with Rebecca for the personal health disease prevention. So obviously, welcome to Heidi. And I attended a rabies webinar, which was quite interesting this month as well. Still working on our latent TB patients. Heidi's pretty paramount in that, so that's been wonderful, and we've got good communication. And actually, those patients are very compliant and want to do the right thing. So they're kind of easy to work with once we track everybody down. So that's been kind of a good thing. And then for my education this month, I felt like it was a little late to do something on the flu vaccine with the numbers still going up. It seems like the season's just a little bit prolonged this year. So we're still encouraging people to get their flu vaccine as well as COVID. So I thought I'd talk a little bit about the flu vaccine. And obviously we all know that the flu in everyone is different. So you can get the flu and be very, very sick, and your neighbor can get the flu and have a little cough and some sniffles and a low-grade fever and be fine. So in a way, that's why we encourage vaccination. So the vaccines work because we develop some antibodies toward the flu when we get vaccinated, and that does take about 2 weeks. So you have to remember during flu season when you're getting vaccinated that there's that empty little 2 weeks even after you've gotten your vaccine that you might be exposed to the flu and get the flu. And even with your vaccine, so people, I'll get this question all the time, right? I got vaccinated and I still got it. So you can still get the flu with your vaccine. However, I think what's important is this last statement: what protection does the flu provide to me? So there was a 2021 study that shows that vaccinated people were 26% lower on their ICU admissions and a 31% lower risk of death. So I think those numbers speak volumes about getting your flu shot, especially if you're immunocompromised or at risk. But we encourage everyone, it's over 6 months of age to get the flu. Last few years, there have been different ways to get it, depending on what age group you're in, depending on how immunocompromised you are. So we have a great staff here that will sit down and help you with that medical decision making, which vaccine you should get, your provider. So know that you. And then people always ask, how do they choose what goes in that flu vaccine? Well, the experts kind of look at the research, and it's a quadrivalent vaccine. So there's 2 against influenza A and 2 against influenza B in your vaccine. So they're taking their best educated guess of what's going to happen in that season. So we'd like to see people in September, October kind of get their flu shot, but even now in February and probably even into March, I would guess that's still going to be recommended because the flu season is still going. If you look at our numbers, and they took a little bump. They took a little bump after winter break for schools, and they took another bump. So they're a little higher than they have been in previous years. So important. And I don't know if that might be related to COVID when we were also isolated. The flu didn't get spread around as much, and we were masking, so respiratory things were kind of a little quieter then as well. So important to get your flu vaccine. And if you have any questions about getting it, important to ask, right? So people have all sorts of theories. I've heard I get the flu vaccine, and I always get the flu. Well, you can't get the flu from the flu vaccine, although there is one live variant we use very rarely, but it's not a live vaccination that you're getting. So maybe, as I said, you were exposed to the flu right after you got your flu vaccine in that 2-week period, maybe you got the flu, but you fought it off really well because you were vaccinated. So those are all things to keep in mind. It's pretty rare not to be able to get vaccinated, previous allergy. That's about really it when we look at your risk factors for getting vaccinated. So important, again, to get vaccinated.
Very good. Thank you. Any questions for Dr. Lucarello? Real quick, so when we're consulting with Quincy schools and maybe Jonesville, is Dr. Lucarello in on those?
I have been in from the beginning, yes.
Okay, good.
So the staff is very good. When parents showed up here to talk, we all got phone calls and we all got involved right away.
Good.
And I think the meeting with MDHHS yesterday was very valuable. There were some experts on there epidemiologists, things that we need
Yeah.
to know where to be from here. So I think the importance is right now case identification. Because again, not that social media isn't factual sometimes, but there's a lot floating out there. So to separate
Yeah.
what we
Fact
really need to start looking at and who's a case, right? Who's a case, who fits to look for all those commonalities that Rebecca discussed. So
Yeah.
that's our first step.
Good.
And we're, obviously, again, I'm a parent as well, so I totally understand the necessity to kind of move this along and
Yeah.
figure this out for these families.
Absolutely. We all are. So we all have that
Mhm.
empathetic heart, and hopefully we
Mhm.
can, we're taking this seriously and we're trying to find some solutions. So it's good. Any other questions? Very good. We appreciate it, madam. All right, on to number 5, departmental reports. We have personal health and disease prevention. Miss Heidi, welcome. I know you're not throwing you in the fire right off the bat, but we appreciate you.
So here's your guy.
You have a half an hour. Go ahead.
Point of the word.
This is not what I was told. There's no written report today from personal health and disease prevention, but we do have some statistics for you. The confirmed and probable case totals are there. We have some numbers on immunizations and referrals, and then on the back page, our WIC participation numbers. So Heidi will have a written report for us next month. It'll be her first one.
Well, we'll look forward to it. We appreciate you being
Got her
here.
to flags until Monday.
Yeah. Just make sure you have the agency song down.
Right.
Don't forget the secret handshake.
And the secret handshake. Very good, Paul. Speaking of Paul, environmental health.
Good morning.
Good morning.
As Becky kind of touched on earlier, we do have quite a few staffing changes that are taking place in environmental health. We hired a sanitarian to replace Jane, who was promoted to supervisor. Her name is Julia Bronson, and she started back on the 12th, and she's doing very well. We have another new sanitarian that's going to fill the new sanitarian position that was created. She will be housed here in Coldwater. Her name is Mackenzie Horsfall. She will be starting on Monday. So both Julia and Mackenzie come to us with really good backgrounds in science, biology, which is one of the things we really are looking for when we hire sanitarians, so that they're able to sit for the registered environmental health sanitarian certification. So really excited about having both of them on board, and it seemed like we just got everybody on board, and then we got one of our sanitarians over in Three Rivers has taken a position with Kalamazoo. So again, it's just one of those things where they're going to other counties because they get more money and get better benefits. And Bethany has been a really good employee for us. She started for us back in 2019. She started actually over in Hillsdale County, where she worked in both food and dental sanitation programs. And then when we had an opening in the Three Rivers office, she wanted to take that, and so we moved her over there. She's has been working in the general sanitation program since then. But Bethany's going to be a big loss. We're going to miss her skills and her very upbeat personality. She's just a fun person. So we're sad to be losing her. So that position has been posted, and we will start doing some interviewing for that position as well. So we have a lot of new staff coming on. So we're really trying to amp up the training as for the general sanitation program. We're approaching the busy season, and I think things are going to get busy sooner this year than normal, just because of the mild winter that we've had. Now the counties are going to have load limits, which really kind of slows down the septic work. That's the trucks that haul the stone and haul when the low limits are on. But we've had such mild weather that I don't think any of the counties are going to have load limits this year. So that could mean that we're going to start getting busy sooner. But anyway, we'll be working on getting folks trained up and getting on par to get things taken care of. The other thing I had in my report was on the Three Rivers ALE, and Becky already touched on that, so I don't think I'll spend any time on that. I did want an update on a couple of other things. Last month, I talked to you about an investigation that was gonna be that had taken place around the Lear Seeker plant in Mendon back in 2002, where they tested for PFAS, found quite a few homes that were affected. Most of those were within the village. Those have all been hooked up to the city water system now, so those are taken care of. There was one that was in the township that is on a filter. But we had a report from some folks that are also in the township outside the village limits that are not on municipal water. They were concerned about the water, contacted Eagle and MDHHS. They are reopening an investigation and going to expand that investigation. So they're going to be doing some testing on some of the homes, obviously that are still on water wells, not on the municipal water system, but some of the wells that were tested back in 2020, and they're including some new ones as well. And they're not only going to test for PFAS, but they're also going to be testing for VOCs, which are volatile organic compounds, and metals. They did some more investigation. They found that there's a potential for those types of contaminants to be in the area as well. So hopefully that sampling will start next month, and I will keep you updated on any news that we get on that, on those water samples. So hopefully we don't find anything, but I'm pleased that Eagle and MDHHS have decided to expand that investigation to kind of calm the nerves of the folks that are dealing with some health issues there. And, you know, so maybe we can eliminate or maybe we can identify something that may be going on there. The other thing that I wanted to talk about just briefly is we were contacted by Eagle recently regarding a homeless encampment that was in Three Rivers. So Eagle was contacted by the Attorney General's office to look into this. Eagle passed it along to us to look into it as well. They had received reports of potentially sewage being deposited on the ground and trash. So we investigated right away. We did not find any indications of sewage anywhere on the site, but it was a mess. There was a lot of trash. So we wrote letters, correction letters to the folks that own the property, and have given them a time frame to get it cleaned up. In the meantime, it appears as though the people are not living there anymore. We had heard that the state and local law enforcement had gone out there and told people to move along. I personally went out there towards the end of last week. I did not see any activity from people. The mess is still there. But we have also contacted the township, and they are involved with their building and zoning people to help us get compliant as far as getting things cleaned up.
Is that Vegas?
Yes, yes, yes. And it's actually along the side of the parking lot of Walmart.
Yeah.
But Walmart doesn't own it. It's actually owned with somebody else. So.
Yeah.
But anyway, we're working on that. Unfortunately, you know, these things are popping up all over. It's a really, really bad situation. These people have to go somewhere. They kind of anticipate that they're going to show up somewhere else around the Three Rivers area, and we'll have to deal with that when it comes. But very sad situation. Obviously, we can't allow unsanitary conditions to be present. So we will work to see what we can do there. That's all I have.
Did you have a chance to talk to the property owners?
No.
So we just wrote a letter
Yes.
and said
Yes.
that. Okay.
Yeah.
I didn't know how receptive they were to it.
We haven't heard back from them yet. One of my sanitarians sent them a letter, and the last I checked with them, which was earlier this week, hadn't heard back from them at all. So they've kind of been non-responsive.
How long a period did we give them to clean up?
To the end of this month.
To the end of this month.
So,
Okay.
yeah, so by the end of next week. So if nothing happens there, then we will forward it on to the prosecutor's office and try to get some help that way.
Okay.
Yeah. Like I said, the township is also involved with that, and the township building inspector is really good about getting compliance, you know.
The building or the zoning?
Zoning and
Was it Doug?
Building and zoning, actually.
Probably Doug Pullman.
Yeah, yeah. So,
good. Any questions? Go ahead.
Thank you, Mr. Chairman. I have two questions to Director Andriachi. That's number one. You have what, 10 or so management classes for food services?
yes, so no, we had one class with 10 attendees,
I see.
yes.
And number two, do you, pardon me, do you inspect school cafeterias?
I'm sorry?
Yeah,
School
yeah, I do.
cafeterias.
Yes, we do, yes.
I wonder you will be able to review past 3 times we visited the subject we discussed earlier.
At Quincy.
Yes, in fact, we did a walkthrough of the cafeteria yesterday when we were there. And yeah, we have reviewed that. And really didn't find anything of consequence, to be honest with you. Yeah. And so, yeah, that's, you know, and that's part of, you know, one of the things that we look for. And there was stories out there that there was a pack of rats running through the cafeteria. So obviously one of the things that we look for on our food inspections is evidence of rodents, insects, those things, and was not, we didn't find anything there yesterday either. So, yeah.
Go ahead.
It's more of a statement than a. Remember back in August, I told you I had a property amendment, they were drilling and checking PFAS. This all starting to finally make sense. I mean, it's 2.5 blocks from Winter City, so they were out and they had contracted up drilling core samples for PFAS. They're back last August.
Yeah, and who was doing those
They
drilling?
got.
Was it
I got the
Eagle?
business card. It was for Eagle. It was a
It
contract.
was for you. Okay, so it was a separate contractor. Okay, yeah, I was not aware of that.
So they've obviously been doing work clear up as early as last August.
Great.
Very good. Any other questions for Paul? All right. Thank you, Paul.
Thank you.
Moving on to Area Agency on Aging, Miss Laura Sutter, who is not here.
Yeah, so I'm pitch hitting, and then we do have Ashley here today, so I want to welcome her. And I'll just run through this and we'll see if you have anything you want to add. So Laura talks a little bit about the victims of elder abuse program and gives some updates there. She does mention that the Transportation Authority in St. Joseph County will be coming to this board for a contract amendment, and that'll be March or April. So just to get that on your radar.
What is that about?
The contract amendment. So when they apply for grant dollars, the contracts, they specify how they wish to use it, and they want to make some changes, some tweaks.
Yep, and I'm on that board too, on the Transportation Authority board. And essentially, the Transportation Authority is not going to ask for any more money. They're just asking for it's instead of it being allocated towards like curb to curb, we're going to have it. There's 2 parts, kind of like what Rebecca was saying. There's curb to curb, and then there's also medical transport.
Mhm.
We're using quite a bit for medical transport, and we're getting allocated both buckets. We just want all to go for medical transport. We're not going to stop doing curb to curb. We just want all of the AAA grant to go towards one specific. So it's not going to change the overall dollar value. It's just how we're going to do it. Yeah. So
It's just more efficient,
Yeah.
I think, for the
Yep.
transportation
Yep.
department.
and they're going to bring together something for us. So it'll be good.
So there is today an annual conflict of interest and disclosure form at your place. It should be 2 pages stapled together. We do need you to sign that and give it to myself or Teresa today. This is an annual thing that you do, and we appreciate your completion of that form today. And then the Aging organization also does a day this year that is scheduled for May 1st. It's called Older Michiganians Day. And you are always invited and welcome to go with us. Laura always takes a contingent up there and also works with the local COAs to take up groups as well. And so if you are available and would like to attend this year, please let us know or let Laura know. And Ashley.
Welcome.
Thank you. Sorry I was late this morning. I have a toddler that might fall into the flu
Oh, no.
statistic. He woke up with a fever, so he's a little bit clingy. He didn't want me to get out the door. I'm Ashley Ellsworth, the field representative for Region 3C, for those that are new that I've not met before. I work closely with Laura on Older Americans Act funded services. So just a couple of updates today. The big one is the Administration for Community Living, or ACL. That's our federal, we have to, they kind of oversee what we do. They released the final rule to update Older Americans Act regulations. This is the first major overhaul for Older Americans Act since 1988. There have been some updates along the way, but this is the first major overhaul. If you want to look into it a little bit more, you can go to acl.gov/OAA rule, or just go to the acl.gov website and you can get there. But it has a nice little bulleted synopsis of key updates. Then there's another overview, but if you get real adventurous, you can read the over 450 pages of the entire rule, which I have not gone through yet. We are in the process of going through that, working closely with ACL and advancing states to see what impacts will be made to Michigan and service programs. The rule does take place on March 15th of this year, so soon, but don't freak out because you have until October 1st to implement it. So any regulated entity has until October 1st. And the ACLS Bureau, my team, is going to be working closely with ACL and Laura's team and all the AAAs across the state to help implement those and make those changes. So they're not just working through them on their own, because I don't think they're huge. There might be a few changes to the nutrition programs mostly, but mostly it's clarifications, broadening of terms, defining terms, and things like that. Because we know the world's changed a lot since 1988, not just COVID. Many other aspects have changed as well. So that's exciting, but also kind of a cumbersome process that we're working through. And the only other update is not even really an update. The federal budget, we have another continuing resolution. So ACLS Bureau submitted another, finding my words this morning, sorry. We gave out another SGA for a month of state and federal funding. I think that just came through yesterday. I think I saw an email come through. We're hoping a budget will be passed soon, but we're just kind of waiting and seeing at this point. Any questions for me?
Any questions?
That, I do believe that award was through through the month of February or through the month of March?
I think the one that came through yesterday would fund through March. And then depending on how things go at the end of March, another will be issued for April. So we're just unfortunately on month for both state and federal until we can get a budget. Depending on the continuing resolution, the way they're issuing them, we can't issue more than a month at a time.
Very good. Any other questions for Ashley? Okay, thank you so much. We appreciate it.
Thanks, Ashley.
All right, letter D, health, education, and promotion. Ms. Chris,
Good morning.
good morning.
So just a couple updates. Our department has really been working and focused on planning and preparation, evaluating what we've been doing in the past and how we would like to shift and move forward. So I've been working with my team and they've been very engaged in the conversation about what does health education and promotion look like as we move forward. Again, we continue to maintain our social media presence, and we did issue 2 press releases in January. And so we appreciate our media partners who share information for us and on our behalf. The community health worker program is continuing, and a couple exciting things happening there. The first is that we have completed the community health worker certification process. So our community health worker has now been certified by MICHWA, the Michigan Community Health Worker Association, which was the first step for us to be able to get her accredited through Medicaid CHAMPS in order for us to apply for reimbursements for her services to the community. So we have completed that process. We've also completed our request for recognition as a provider to Medicaid, and hopefully we will have an answer on that application forthcoming soon, so that we can begin the process of reimbursement for services rendered. The greatest area of need for the month of January that Rachel worked on was food, housing, transportation, and health insurance, which, as you can imagine, probably correlates into some of the homeless issues we're seeing as well as just pressure on families as the public health emergency has unwound and folks are just trying to adjust to a new financial normal. As Rebecca mentioned, though, kindergarten oral health assessment, I would just like to add that we are including the required oral health assessment form from the state of Michigan for those families who have private dentists that will be taking their children to be evaluated so that the parents can get that form completed and return to the school. And we will, again, are continuing to look at the program from the health department's perspective. Just a couple updates from the EPC side, since as of Monday, I will no longer be serving in that role. We will be having an ICS 400 course in this room next February 28th, so next week, 29th. That class has 15 students enrolled. We did partner with the Sturgis Chamber of Commerce and did a Stop the Bleed training for the chamber membership. There were 15 kits provided to the participants that day. Had a great time working with Jeff Baso over in that area to present that information. So I'm excited about that. We're still looking for partners that we can work with to extend that training program. The Health Alert team did form a tabletop exercise on February 1st related to a foodborne illness outbreak. The participants were very engaged in the conversation. We had a lot of good talk and we identified a couple of opportunities that we need to look into further. But since we haven't really done an internal tabletop exercise because we were too busy in a functional response, it was good to kind of get back to that training. So thank you.
Very good. Thank you, Chris. Any questions for our health education promotion? All right. Well, thank you very much, Chris. Moving on, financial reports, Ms. Teresa.
Yeah, so good morning.
Good morning.
The bills are large this time, so I'm going to point out a few things to you. On page 29, you'll see Jurgens Piping. It's just a small bill, but that was for the drinking fountain in Three Rivers through that infrastructure grant, so that's a little bit unusual. Then a little bit further down that page, you see North American Rescue for $14,355. That was for the Stop the Bleed kits that Chris is using for the training she was just referring to. That was also paid for by a grant. And then the elephant in the room is the big thing down there, State of Michigan MDHHS for $468,446. That's grant money that they overpaid us for the last fiscal year that we returned to them. We were gracious enough to hold on to that for them and collect the interest, but they wanted it back, so we sent it.
We didn't have to pay that interest back to them.
No,
Win-win.
I know they asked me if I wanted them to not send the money for this year, even though if we weren't going to spend it, we could have them, reduce it. And I said, no, keep sending it.
Yeah. Very good. Any questions for Teresa?
Yes, I think I know, but I'm not certain. Page 29, State of Michigan,
We just went over that.
468.
Yeah, that's the grant money that was for COVID grants that we did not spend, that they wanted us to return the unspent money.
Do we have the potential to spend? Did we have the potential to spend that money? I know we've talked about in the past where sometimes we just don't. we just don't have the need essentially, and so we can't,
That's exactly.
and that's why there's no need for it. Yeah, okay,
We spent what we could,
okay,
I think.
okay.
Well, yeah, I mean, I don't like to spend,
Or spent what was needed.
Yeah. we'll
yeah,
see that.
grant dollars, they were taken away from somebody hardworking, yeah, fair dollar.
Sure.
And if I don't need to spend it, I would rather not frivolously spend it
Sure, thank you.
and give it back.
Yeah.
So,
Good. Any other questions?
Move to approve the January 2024 or payment as presented.
We have a motion and support for payments. Any further discussion? All in favor with an eye?
Aye.
Opposed the same? Motion carries. B, review of financials.
Yeah, so you also have your balance sheet and your expenses by program. We continue to monitor how we're doing against our budget amendment. We're currently 6.44% under budget and monitoring things, nothing that I'm terribly concerned about. Be happy to answer any questions that you have.
And just to point out here, so Teresa, you just sent the state a check in January, $468,000.
Yes,
And on the balance sheet, you're showing due from the state of a negative amount of $62,159. So based on your projection right now, through the end of our fiscal year, we would have to pay back $62,000 to the state.
no, that's how much of their money we have right now that is
That-
not earned by us. So
Like-
it's going to continue to grow as the year progresses.
But like I said, if the fiscal year ended right now, based on the current fiscal year, that's what we would have to send back to the
Yeah.
state.
They grant money, what do they send it monthly, quarterly?
They send it monthly. So most of our grants that we deal with, we get quarterly payments from them. And we fill out a quarterly financial statement that tells them this is how much money we spent, and then they pay us that amount of money. These particular grants were COVID grants, and they pay us 1/12 of the total awarded every month, whether we spend it or not. We still report quarterly to them, but they don't ask for it back until the end of
So the 62 is what they sent us, I mean, sorry, but it's what they sent us or what we have used out of what they sent us?
That's what we have not used out of what they've sent us at this point.
And don't anticipate, or, may not anticipate using, so right now, that fiscal year ended right now, we'd have to send that back to the state.
I mean, but if something catastrophic happened and we had to, gear up again and bring on some temporary staff again, and we would have money to do that.
If the need arises, we can
Yeah.
use it.
Or have it not needed, need it not have it?
Yeah.
Move to approve the month-end financials as presented.
All right, we have a motion
Second,
and we have support. Any further discussion? All right, all in favor with an eye? Aye. Opposed, same. Financials reviewed and accepted. Committee reports. Finance Committee. We just had the Finance Committee.
Yes, we do.
It was amazing, as usual. We had lobster and steak, and everybody had an amazing time. Lanius and I,
On the banker's dime.
yeah, on the banker's time, we solved the world problems, and we will be bringing those problems to you guys as an overall board to further discuss and solve. So we'll have that. The minutes should be included. Teresa had the opportunity to pass those out to everybody. So, pretty short.
I'd move for the final committee meeting minutes as presented.
We have a motion. Do we have support? We have support. Any further discussion? All those in favor with an eye?
Aye.
Opposed, the same. Very good. Okay, moving on to B, program policy appeals.
Well, Commissioner Baker and I were present yesterday for the Program Policy and Appeals Committee meeting. I think we went longer than you guys did this morning. Your Finance Committee meeting, but still relatively short.
You guys had peanut butter and jelly.
Yeah.
well, we like to care of business, not just eat
No.
lobster.
No. Commissioner Bread and Water.
Okay, Fred, one. Very good.
And there will be some items underneath new business later on that we will be discussing. Yeah, and I would move to approve the Program Policy and Appeals Committee meeting minutes as presented.
And I'll second that.
We have a motion and support. Any further discussion? Seeing none, we'll take a vote. All in favor with an eye?
Aye.
All opposed, the same. PPE is accepted. All right, moving on to unfinished business. Number 8, letter A, interior paint project for Hillsdale. Ms. Rebecca Burns, we discussed this at length our last meeting. Go ahead. What do you got?
So the same item is back before you today. There was a request to have this placed back on the agenda, so it is there for you. The bids have all been made public at this point, and so hoping that, anyway, go ahead.
Commissioner, I would move to accept the bid from APEC Painting for the painting of the Hillsdale Board of Health office.
Okay, we have a motion. Do we have support?
For it.
We have motion and support for Apex Painting. Any further discussion?
Just clarification. At our last Board of Health meeting, it was mentioned that we have to have 3 bids. And after that meeting, we did receive a copy of the Board of Health procurement policy that was last approved by the Board of Health in 2018. And that procurement policy, as adopted by this body, does not require 3 bids unless it's over $150,000. That procurement policy was reviewed again yesterday at the Program Policy and Appeals Committee meeting, and we did not see any changes that needed to be made to that policy. The health officer and Teresa have reached out to multiple different companies looking for estimates. We received 2. Apex Painting was the cheapest of the 2, and that was the reason last month that it was recommended for approval, and that motion failed on a tie vote. So it's back before us this morning. We have 5 members here.
Yep. And I think one of the things that was mentioned last week, which I think was rightfully mentioned, is maybe having more board members here. We have a board member that's probably not going to be here for a couple months just because he's snowbird. But we do have Rusty here now who can offer an opinion as well. So I think that's good that we did bring it back to the full board. Yep. Go ahead.
I wasn't here last month. Did someone have a copy of the other bid? Or at least tell me what the number was, so I'm not voting on something that I'm only seeing in bid.
Commissioner Baker, if you, I don't know if you look online at the Finance Committee material, it was in, I do believe, the December Board of Health Finance Committee, or the January
Yeah,
Board of Health Finance Committee material, and it was about $500 more than the bid that we have in front of us. $544.
And I believe it was R&L.
NNL.
N&L.
NNL, yeah.
I was close.
Yes.
It's initials. Very good. Any further discussion? Okay, seeing none, we'll vote all in favor with an aye. Aye. All opposed the same?
Aye.
Okay, we have 4-1. Motion carries. Moving on to closed door session. Are we going into closed door?
Yes,
Okay.
Commissioner, we, and
For that.
again, because Commissioner Baker is here and he was not here at the
Yep.
last meeting, I move to go to closed session, consider materials exempt from discussion or disclosure by state or federal statute pursuant to section 8 of the Open Meetings Act, that's 15.268, and section 13.1 of the prison, with exempt from public disclosure information or record subject to attorney-client privilege.
I second.
We have a motion and support. All in favor?
Point of order.
Order. You're going to get in.
Probably. This requires a roll call.
Okay. Roll call vote, please, Ms. Teresa.
Commissioner Matthew,
Yes.
Commissioner Mister,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
Sure.
Commissioner Lanius.
Yeah.
All right. Yep. All right, we are back in. Wait.
That's where I would move, we go back to open session.
Thank you.
Do you need to do a roll call vote or?
Do I get a second?
Second.
Rusty seconds. All in favor?
Aye.
Aye. All opposed the same? All right, we're back in action. Back in action.
I would move to accept the attorney-client, Bruckman the attorney recommendation and revise our, social media policy as of today, February 22nd, 2024.
I have a motion. Do I have support?
Support.
We have support from Rusty. Any further discussion? Seeing none, we'll do a roll call vote.
Okay, Commissioner Matthew,
Absolutely no.
Commissioner Hoffmaster,
Absolutely yes.
Commissioner Leininger.
Yeah.
Commissioner Baker,
Yes.
Commissioner Lanius.
All right, 3-2. Yeses have it.
Commissioner, I would move that we direct our health officer to communicate with legal counsel regarding written public comment option for Board of Health bylaws.
All right, we have a motion. Do we have
Support.
We have support from Commissioner Baker. Any further discussion?
I feel this is a good option.
Yeah.
I really do. I mean, it opens the door. If someone's got a legit question, they don't have the option now. Anybody can write in if this moves forward, they'd be able to write in a comment and it'd be read at the meeting.
Yep.
I like it.
So we're gonna direct staff to ask legal counsel if we can have public comments either written or emailed in prior to our meeting and have those read into the minutes and out into the public atmosphere.
And Commissioner, I would just caution when we say that. Our minutes currently don't include in them what individuals say during the public comment.
Correct.
It just says that they spoke, because
Correct.
minutes legally only have to include the
Public comment.
date the meeting was, the time the meeting occurred, who was present, who was absent, and what actions were taken. That is the legal definition of minutes for Robert's Rules of Order.
Yep.
You get too much stuff, it's too cumbersome, and it's not required.
Yeah. Agreed. Commissioner Matthew.
I would like Ms. Fisher to look into the possibilities of Zoom so the citizens can call in. We spend a substantial amount for putting this video system here. I think it will be less cost than what we have done. And thank you, Mr. Chair.
I appreciate that comment. Is there a consensus with that?
Well, again, that's not the motion on the floor.
Okay.
Commissioner.
Let's call the question then. So the motion on the floor is to ask staff to look into legal counsel as far as, having written in comments. All in favor with an aye?
Aye.
All opposed the same? Okay. So motion passes. Now on to real-time public comment. Is there consensus for staff to look into that avenue? Commissioner Matthews has expressed obviously wanting the staff to at least investigate that. I personally am okay with them not doing that. I would hate for them to waste their time if essentially we're not going to do it anyways.
Ms.
Just real quick.
Thank
Anybody
you.
else have consensus? Hold on just a second.
I even kind enough to make a motion for that.
Okay.
Mr. Chairman, I make a motion to address the issue of just say Zoom electronically. Our taxpayers can reach, they can speak 3 minutes each, 2 segments, and find out how much the cost is. Something like that.
Okay. So we have a motion on the floor. Do we have any support? Steve supports it. Further discussion.
Slippery slope is what's in here.
Well, again, I think, to Mr. Hoffmaster's point, I think we're maybe having staff spin the wheels too much in that.
I mean, ADA is already out there that if you're disabled and there's a bunch of other reasoning that you can do that. I mean, that's already in play through the Open Meetings Act. So you can open up a slippery slope here.
I'm not in favor of it simply for the fact that there are a number of different avenues that the public can engage us and be a part of this board and this community. And I'm okay with those avenues. I think it's expensive for the taxpayers. I think it is, I've seen it in other avenues that other boards that I'm on, it go unused. So I'm okay with not having it.
Commissioner, my concern on the expense side is not necessarily the cost of the program. So some of those programs you could get for nothing. Well, my concern is the cost of somebody to sit back here and monitor or administer that. We're taking another agency staff person to do that when, you know, we're already maybe short-staffed across the agency. And so that's why I can't support looking at it.
Good.
Mr. Chairman,
One more, yep.
clarification about that you don't need, Mr. Chairman, another person to handle the Zoom. The same person who is controlling right now, he or she can do it. And if you need the expertise, I can give you the information. You can talk to them. Thank you.
Thank you. So right now we have a motion on the floor for staff to look into a real-time public comment. Motion was by Commissioner Matthews, seconded by Commissioner Lania. All in favor with an aye.
Aye.
All opposed with an aye. Motion fails. All right, moving on to new business, number 9.
So
Yep.
the annual conflict of interest and disclosure policy is our area agency on aging 3C. I mentioned this in Laura's report. Some of you have already very kindly signed. If I think, okay, so I think we're all set with this and we can move on.
Very good. B, intergovernmental agreement, page 42.
And I will take this, Commissioner. Again, this is an item that we've been discussing for a while now. And this is an item that was presented and discussed at the Program Policy and Field Committee meeting yesterday morning. Starts on page 42 of our packet. And if you will look through there, the items that were changed are highlighted. On page 3 of 10 of that intergovernmental agreement. And a reminder that intergovernmental agreements must be approved by all 3 county boards of commissioners. And so this was last approved in 2013. To be effective January 1st, 2013, it would have been approved before that. But on January 1st of next year, Board of Commissioner term for the state legislature goes to a 4-year term. And underneath article or section 6 of the intergovernmental agreement, terms of board membership, our previous language said that the terms on this board shall commensurate with Board of Commissioners' term. The sentence above it says that they're, you know, when our county is appointed, it's a 2-year term appointment from the county to commensurate with the Board of Commissioners' terms. Well, to make this comply with the state statute that's changing January 1st, our recommendation to the board is to remove that statement that it commiserates with the Board of Commissioners' terms because it no longer will, going to a 4-year term. Still leaving it a 2-year appointment from each county to the Board of Health. That way, the counties have the opportunity midway through a commissioner's term to rotate somebody else on if that need is there within each county individually. But still asking the county to make, and the commissioners to make a 2-year commitment to the Board of Health. Because it does take some time to learn Michigan public health rules and code and stuff, and to understand the financial statements here at this agency, which are a little different than our county. The other thing underneath Article 10, finances, and if you'll remember earlier this year, we removed from our board bylaws what is the second yellow paragraph on this page, the language that says we're going to ask those counties to make those contributions on a quarterly basis. Again, that was in our bylaws that we as the Board of Health approved, but that was not in the intergovernmental agreement that the counties approved. And more concerning is the language that you'll see up there in that first paragraph that is recommending to be removed is language that says the county shall make under such terms as shall be specified by the board. And that's the board of the county.
Not us.
That's not us. And so if you look at that legally with that language that's there today, when we ask St. Joe County, Branch County, Hillsdale County for that local appropriation, legally the county board of commissioners could say, okay, we're going to pay that, but we're going to pay that on December 31st of our calendar year. Which doesn't help the Board of Health because after the 60-day window for the Board of Health to figure that calculation into, the fiscal year that the Board of Health needs that contribution. And so those are our recommendations in addition to revising the date on page 10 to January 1st, 2025. And again, our proposal and our ask is that for each commissioner to take this back to your county and say, these are items that the Board of Health is proposing that we change, and just these items. Because if St. Joe County wants to change something else,
Everybody else has.
Never else does.
everybody else has to.
Yeah.
Or we're stuck with this, or we continue to operate underneath the intergovernmental agreement that we have.
We wouldn't do that to you guys.
So with that, we'll move that we adopt the proposed changes to the intergovernmental agreement as presented, and we respectfully ask each county to approve them as presented.
I second.
We have a motion and support. Any further discussion?
Yes, Mr. Chairman.
Yes, sir. Commissioner Matthews.
I would like the Director of Finance or Health Officer, Ms. Burns, to send this copy to our all three county administrators so he or she can put that into our agenda.
Well, it's gonna have to be, so we got.
And in that regard, I would ask that we send two versions. Number one would be this marked up version showing those changes.
Correct.
And then would be an unmarked, the version with a completed change copy that can be the copy that's approved and adopted by each county. Signed.
He wants to draft up a resolution as well.
I think that we already have one.
Yeah.
The page 1 of 10, I think, is a resolution approving that the counties would use. If memory serves me right.
I can certainly just use this language and.
Yeah.
Or just point to it.
Yep. Very good.
Yep.
Any further comments, discussion? All right, we have a motion on the floor with support. All in favor with an aye?
Aye.
Opposed, the same. Motion carries. Nice work on that, guys. We appreciate it. All right, letter C, March Board of Health meeting schedule change.
Yeah, so right now, we will not have quorum for March. And so.
What's going on?
Everybody except for you.
You can still come by yourself.
Yeah, see, you can join us.
My wife will be going. I'm gonna get a lot of my kids. It's gonna be a fire out.
So you're going on vacation too.
Oh,
Staycation. All right, so originally we were supposed to meet on March 28th.
21st.
No, well, the 28th is when we were scheduled to meet.
Yes, that's when we were originally going to meet.
Yep.
We were talking about moving the Board of Health meeting to the 21st, Thursday, the 21st. We have Ms. Teresa's checked with the schedule for this room, so we have that taken care of. I think the majority of us can make it. Go ahead.
We have work meeting at noon. So if you can cut down the agenda, that way I can be there at least 15-20 minutes early so I can review.
Yep.
and
It's 11 o'clock now. We get a close second.
Yeah.
and I would ask the same thing because, like today, I have a meeting in Brooklyn this afternoon.
New York, huh? Where are you going?
Find a Concord, you got.
Yeah.
I will that day as well have a meeting in Brooklyn that afternoon. So
Okay. So we'll try to keep it light. Teresa?
If I may, we may want to talk about the next item before we firm this up. And the reason that I say that is our auditor is not available the week of the 28th, which was or when the meeting was originally scheduled to happen, to come in and do the audit presentation. And generally, the auditors or the boards like the auditor to give them the presentation before the audit is filed with the state. The audit has got to be filed with the state by the last day of March. So if we move it to the 21st, the auditor is not available to give that presentation on that day. He could come and give you the presentation in April after
You mean the 28th of March? He's
he's not available on the 21st either because he's actually leaving for his vacation on the 21st.
I guess at that point, we really need to meet
So-
in March.
He's not going to be available on the 21st either. So if you really want to see that audit report before it gets filed to the state, then the 21st is not going to achieve that. However, whether you get the presentation or not,
Commissioner Mathis, go ahead.
you don't.
Thank you, Mr. Chairman. So the auditor, she or he cannot be here on 21st nor on 28th. Am I correct?
Correct.
While he or she is in Fiji Island, can they zoom in that rush?
It sounds like on the 21st they're traveling.
Traveling, airplanes, yeah.
On vacation.
Well,
Now, they did indicate that they could send a very junior member of the team to do a presentation.
One, a question in regards to that. Some of the other boards that I serve on, the auditor comes and presents to the finance committee. And just the finance committee, not to the full board. I guess, and so that's a question of if we want to go down that road. When we, and not that I necessarily like that.
The only problem you're gonna have with that is that I don't believe Commissioner House is gonna be back by then for March 18th, and it would literally be me and Steve, and I'm fine with it. I'm comfortable with it. I'm sure Steve is too. It's just that 2 out of the 6.
Well, so let's just be honest. You don't change
That's
auditor.
No,
Right.
we don't do anything.
So does it really matter?
Right, I mean, it's truly affirmative.
Yeah.
I mean, the auditor's gonna file their
No matter
statement
what we
whether
say.
we want it or
So
not.
why don't we just
Right.
wait till April?
Right.
I'm fine with that.
The April meeting?
Yeah, I'm fine with that.
Regular
I mean, because it's literally gonna be the same thing. It's not like even if we have any objections, it's not gonna
Yeah.
change anything.
Right, I mean, we could be like, oh, that's false. Well,
Yeah.
it's the audit is the audit.
Or can they, other than, I would say last year, we got filed with the state for Tulsa County for 2022, was really not correct because he listed Commissioner Lanius as a county commissioner, and in 2022, he wasn't a county commissioner.
Right.
Okay, so I would ask that the auditor send us the digital copy of that.
Without preview. Yeah.
Before it gets submitted to the state, so that we can read it and ask questions about something like that.
So, yeah. That sounds good.
Will do.
Definitely.
Makes sense?
Problem solved. So we're gonna have a meeting or?
So are we?
21st. The agenda will probably not have, it's hard to say, right? We don't anticipate right now a heavy agenda in March, but,
Well-
cancel it now and just say we're not gonna do it.
And
maybe we
also-
can.
And also to Rebecca's point too, kind of offline, if there are issues that are going on in the public, such as the schools, they kind of cropped up out of nowhere, we probably should get together just to make sure that we have our eye on the ball. So I'm okay with going on the 21st.
I would move we change the March Board of Health meeting from March 28th to March 21st.
Or
We have a motion and support. Any further discussion?
Yes, make that meeting very brief.
Making it brief, according to Tom Matthews.
that's all up to you.
Yeah. Just to be clear, the finance committee meeting is on the 18th. Steve, we talked about that. So we're good. The program policy and appeals is still on the 20th. So we're still good there.
Yep.
And then we will have ours on the Thursday, much to Rusty's dismay, the day
Do we have it on the 20th, Brent? Make the motion. We're already gonna be here on the 20th.
You two are right. Hey, we can't change the motion now.
I'd like to amend the motion on the floor.
Closing discussion. We're going to vote on the motion as presented. All in favor with an eye? Aye. All opposed the same? All right, we're on the 21st. Be there, be square. We're good there. Auditor presentation we talked about. Obviously, we're good there, right, Teresa?
Yeah.
Okay, last but not least, it looks like item E, Hillsdale Building Carpet Replacement.
From the finance committee meetings.
Commissioner, if I may,
Yeah.
before we get into this,
Yes, sir.
I want to bring an issue to the Board of Health that I have our health officer and Teresa reach out to our legal counsel regarding. I have an insurance relationship with one of the companies that submitted a bid for the in the Hillsdale office. I'm an insurance agent, they're my customer. Depending on if they get awarded the job, I potentially may receive some increased commission, depending on how they structure the work, whether they keep it in-house or not. I wanted to make sure whether our legal counsel felt that was a conflict of interest for me to discuss that issue before it came before the board. I will say we did receive communication back from the attorney, and he does not feel that that is a conflict of interest. So, but I wanted to make sure everybody else here knew that before we got into discussing those bids.
Good, and I appreciate that. I appreciate that integrity, Commissioner Leininger, and nobody else on the board knows who that person is and has not been influenced by that. Obviously, we have no idea who your customers are. So, but I appreciate bringing that up. Our counsel did say that it was not a conflict of interest, so we're in good shape there. As a board, are we okay with Commissioner Leininger voting on?
The reason we have a low bid is because it's a low bid regardless of who it is.
Yeah.
So absolutely.
I would agree with that too, Commissioner Mann.
I too, Mr. Chairman, appreciate Commissioner's openness. Thank you for that. And also, he is not a mushroom just came up. He has business over 25 plus years, and he's a community leader. The business, whoever he or she applied here, didn't started with him yesterday. So thank you, sir. I appreciate it.
That being said, you want to go through the
Sure.
bid right now?
Yep, I think maybe Commissioner Matthew might be interested in that. So this is the information. Oh, I'm so sorry. There's another one.
You not be sorry for that.
So this is the information we discussed this morning. So we do have 3 bidders. We originally asked for broadloom, which is this regular carpet, okay, the stuff that we are sitting on right now. And then we had one bidder that gave us both a broadloom and a carpet tile bid. And so after we had taken a look at everything last month, we said, let's get carpet tile bids from everything. So with the idea that carpet tile has certain innate properties that make it a better product in the long run in a commercial situation. So the bid that the agency is recommending is from Willowbrook Interiors, and it is the product that they list as Matrix Luminous. This is an 18-ounce tile weight product, and when you finish adding everything up, that price tag is $39,527. The product has a 30-year commercial warranty. We asked the company, what is the usual length of time, and 15 to 20 years in a commercial building is pretty expected for a carpet product as far as its life span goes. They did provide us with a different product that would be a little bit less expensive, but it's polyester as opposed to nylon, and polyester doesn't wear as well. So after reviewing the tile weight and the other items in the bids, which include furniture moving and final price tags for all of these, we are recommending the Matrix Luminous. How does that compare with, for example, the next one, Country Carpets? Country Carpets, their bid is for a 17-ounce tile weight product, still nylon, but their price is higher. And for the tile, the $68,133. And then Schemmel's, again, a nylon product, 22-ounce tile weight, so it is better than the 18-ounce tile weight. Final price tag of $50,318, and Schemmel's price does not include any furniture moving. So we would have to arrange with county, tack on additional cost. So again, bottom line, we are recommending the Matrix Luminous product, and that bid came from Willowbrook Interiors.
All right, very good. Thank you for that. Thank you for the work put it into to this. Do we have motion for the staff's recommendation?
I would make a motion to accept Willowbrook Interior quote for $39,527.
We have motion and support. Do we have further discussion?
Yes, Mayor.
Yes, sir.
Commissioners, I'm concerned about this bid. I would have rejected it flat out. Because it's not a complete bid. If you look right there, it says floor prep will be billed separately as time and material.
Then what is that? That's on the Willowbrook.
That's on the Willowbrook one. If you look at basement area, there. As well as on the regarding porch. The last sentence. Okay, if you look at this page, Commissioner, it, right before you get to the Shaw hook, or it says I have included 5 choices. Floor prep will be billed separately, time and material. I have no idea how many square footage they're looking at in this replacement. Okay, so I can't compare.
Is that just for the basement area?
No, it's on the previous page as well. Okay, so you're not accepting your bid is not, this bid is not complete. As a complete bid. Okay, looking at the other 2 bids, I'm looking at multiple different square footage. What are we doing? Why the differences?
They measured,
And-
we did not.
And I have no idea how many square foot they're saying they're doing from Willowbrook.
Well, on this, it says price includes new carpet, carpet tile, adhesive, removal, disposal of existing carpet, installation carpet, carpet tile of your choice. New moldings between carpet. I mean, it goes through all the things that they're, what more floor prep is there than removal and,
You have no idea whether there's gonna be a complete underlayment.
but is that,
They may have to go in and scrape,
They may have to
scrub, or grind.
spend many hours scraping the old glue off.
I didn't catch that.
Yeah,
Separate.
yeah.
Sorry about that.
but are the other ones gonna have to do the same thing?
I would say, well, they will, but if you look at,
Is
the
it
bid-
included
to
in?
me, there's a bid that's complete. I don't like the price on some of the things. The question would be is, you have built in this cost for moving furniture. Can we get a commitment that if it doesn't cost that much, or you won't charge that much? What the bid from Country Carpet has included in it, that floor prep. And they've built in for the need for some sub-layment.
Those shovels. The right here, removing disposal of existing carpet and adhesive.
Yeah, but it says that on this one too. It says price includes new carpet, carpet tile, adhesive, removal and disposal of existing carpet, installation of carpet, carpet tile of your choice of color, new moldings between carpet and existing tile, freight and taxes. So that's what I'm saying. All of that, I think your point is correct, Brett, but the thing is they are apples to apples. They don't know what's underneath that thing. But if there is this second layer of 1970s shag carpeting under there, both of them are going to have expenses that they're going to pass on to us to remove that. I don't think it's just one or the other.
And these are estimates, not proposals.
Correct. I mean,
They're
they don't know.
proposals, you're bound to it. Estimates, you're not.
They're not going to know what they're going to get into. So I'm comfortable with it because I think they're all 3 under the same guidelines. Like, hey, we don't know exactly what's underneath there, and that's I think what Willowbrook is saying. God forbid there'd be something under that we really have to, put some elbow grease into. But all 3 of them are probably going to have that. Keep in mind, this is
All 3 of them very well will have that
yeah.
carried on, but is it in the quote? And this one isn't, because it says right there, floor prep will be billed separately, so that leaves an open end. There's no final number on that. Could it potentially make $10,000? And if that's the case, then this bid goes to $49,527. But we don't know that because it's not.
But in all honesty, guys, think about this practically, right? So we're gonna all the bids are out there. we're gonna say, Rebecca, you're gonna have to go back out, get bids again.
Well,
And essentially, in all honesty, I read this Willowbrook thing as we don't know what's under there. So we're gonna cover our butts by just throwing that out there, even though in reality, more than likely, there's not gonna be anything under there. Or if there is something under there, all three companies are gonna have to handle it the same way. So I mean, I think we're gonna have staff go through this process again, and essentially, unless you literally want them to write in the thing, whatever's under there is on our own dime. They're gonna have to put that in the contracts. Which is not gonna happen, right? So all three of them are under the same guidelines. Truthfully.
well, but if you look at least the one bid here,
And to Rusty's point, it's not, if they find something, they're gonna bill us. It's gonna take.
That's why it's an estimate, not a proposal.
Exactly.
Yeah, that's a good point.
I mean, I run proposals through my business and I'm locked. There's no coming back and saying,
This
you
is
know,
an
I
estimate.
found this, this and this. It's too bad.
Yeah.
And the proposal,
So I'm comfortable moving forward with the recommendation.
Brent, if you enlighten me, please, on this country carpet bid that is so complete, where is they're gonna clean the prep for
Okay.
what's the
so,
strip?
so they have additional, some material costs. If you look down there,
Page 8?
page 5,
Um,
they have even included in their quartering subfloor and staple, So you're taking care of that labor,
Well, that looks to me like they're covering it up.
It looks like they're coming in and putting.
Yeah.
Yeah.
And they've got,
which is cool if we need it, but if not, we're spending an extra $15,000, but
no, that's $480. Just that is $480.
right,
That's the subfloor.
yes.
That's one.
that's for materials. That's not labor.
May I ask,
But that's gotta be included in here.
limit on the grant?
Labor's coming somewhere else. I mean, that labor's in here somewhere.
Yeah,
So say that 480 is not the total price of putting that down. That's just for the material.
Right.
So
quick.
commissioners, as far as the grant goes that we're using to pay for this project, we could accept any of this. So just so that, I just want to put that out there.
we're not being financially responsible.
Yeah.
And we do
again,
try very hard to be financially responsible,
To me-
just for the record.
to me, and again, I haven't had this. I would throw the I would ask Schemmel, because as far as I'm concerned, we talked about a complete bid. Last month we talked about the bids for the paint and what's detailed and itemized and what's not. And looking at a project like this, you say, well, it's an estimate, it's not a proposal. I'm gonna go back to that estimate and say, well, you said it was gonna be this, now you're telling me it's more, why? I have no recourse to do that with
Any of them.
either of the other estimate. With the one from Wilbur, the one from Schemmel. Again,
And also, I would say country carpets too.
no, to me, it's itemized, it's detailed. And again, the bid from Willowbrook, I have no idea how many square foot they're talking about in this estimate. How do we know that they're considering the entire up there?
Well, like Rebecca
You're
said,
putting the main level for carpet and tile. The main level.
I mean, that's, they measured, obviously, right?
All of the companies did their own.
Did their own measure.
Yeah.
Okay.
I didn't do anything.
Well, I appreciate your concerns, Brent. Let's call the question so that we can kind of move forward. So the motion on the floor is to accept the agency's recommendation of Willowbrook for the Hillsdale carpeting. All in favor, should we do a roll call? Let's do a roll call.
Commissioner Matthew,
Accepted? Could you clear that motion? What was it?
Accepting the Willowbrook bid.
Thank you, sir. Yes.
Commissioner Hoffmaster,
Yes.
Commissioner Leininger,
No,
Commissioner Baker,
Yes.
Commissioner Lanius.
All right, motion carries. Congratulations on your new carpet. Yeah, that will last for 50 years. Okay. It won't. Moving on, we are done with new business. Item 10, approve closed session minutes.
We already.
We
Oh,
are.
No, we did not.
No, we
not
didn't.
do that.
I move to approve the closed session minutes that were read to us prior to exiting closed session.
We have a motion. Do we have support?
Second.
We have motion and support. Further discussion? Seeing none, all in favor with an eye?
Aye.
Opposed, the same. Motion carries. Number 11, public comment. Ashley is our only public, unfortunately. So,
She already commented.
Dan, share a comment. She did a phenomenal job comment, by the way. Any other public comment? We'll close public comment. Moving on to adjournment.
Mr. Chairman,
Yes, sir.
I make a motion to adjourn our February 22, 2024 meeting.
We have a motion. Do we have support? Support. We have a motion and support. All in favor with an eye? Opposed, the same. Motion carries.